Assalamu alaikum. I'm Dr. Motir Hani, Assistant Editor at Dental News Pakistan, and I'll also be the moderator for today's live session, Challenges and Opportunities Post-COVID-19, Future of Dentistry. Bring my speakers on in a few minutes, but first, a couple housekeeping items. If you have any connection problems during the session, we advise you to move as close to your wireless router as possible. And sometimes leaving the meeting and then rejoining will clear everything up. If you're still having problems, then kindly share responses in chat section and we'll try to answer as quickly as possible. The presentation should be only verbal and each panelist should speak for 5 minutes only. For those whose presentation may be longer than 5 minutes, must share their questions to cover the remaining presentation in the panel discussion by sending it to the moderator through chat option. Once the speech will go beyond the allotted time of 5 minutes, the moderator shall mute your video. There will be a discussion round in the end. In case any of the panelists has a point to add, then they can do so by using chat option in the Zoom app and ask moderator permission to unmute. The moderator will then allow you to talk by unmuting your video. Kindly check that you have proper audio-visual settings. Make sure that your screen is on landscape mode. Panelists coming after 6 p.m. shall not be catered due to technical issues. To all my listeners, when you have questions for our speakers throughout the session, you can use the comment section to submit your burning inquiries, and we will add them to the queue. Please try to keep your questions to those that will be useful for our listeners. And with that, I am so thrilled to welcome all our speakers. The keynote speaker for today's session is Ms. Cuny. She has been associated with dental infection prevention and patient safety for the past 30 years. She is the Director of Environment, Health and Safety and Associate Professor at University of Pacific, Bryony School of Dentistry in San Francisco, where she is also Assistant Dean for Global Relations. Ms. Cuny is a member of National Occupational Research Agenda Council and has served as a reviewer and subject matter expert for CDC. Please join us, Ms. Cuny, on camera and window. Hello.
Hello, thank you. Good evening in Pakistan and good morning in California. I'm very happy to be here with you today, and I thank the organizers for inviting me. I think that this is an opportunity that we have during this time while we're taking a pause to really reflect on how we can better protect our patients, our colleagues, ourselves, and by extension, our families. Some of the things I think that we can do is review guidelines and recommendations for infection prevention and think about what we might do differently moving forward when the world gets back to normal and we can resume our regular lives. This pandemic has taught us a big lesson about how we interact with each other in our professional lives, especially in healthcare, and the importance of vigilance with infection prevention at all times, not just during a pandemic. I think that one of the difficulties that people have sometimes is finding sources of reliable information, but it is out there and it's available to everyone for free. The Centers for Disease Control and Prevention has a lot of information on their website. The Organization for Safety, Asepsis, and Prevention, which I'm associated with, is osap.org, has a lot of free toolboxes and information that can be used to learn more about infection prevention and what can be done every day in dental practice, whether it's using safer devices, wearing and using personal protective equipment properly to prevent transmission of disease during dental care. There's many things that we can do, but we have to do it as an entire profession, and within each dental practice, it needs to be done as a team so that everybody who's working there understands their role in providing safe dental care and understands how to work together to ensure that safety that we're looking for. Some of the simple things, that we can do to practice safe dentistry is think about how probably before this, we didn't ask our patients, do you have a respiratory illness before they make an appointment to come into the office? We want to know if patients have symptoms of diseases that can be transmitted through the droplet or airborne mechanism so that we can delay treatment for those patients until it's safe to treat them. And review our standard precautions that should be taken with every patient. That's, changing gloves between patients, wearing a mask, wearing eye protection, because it isn't just respiratory illnesses that we're concerned about. There are bloodborne diseases that we know are transmitted in dental settings. HIV, hepatitis B, hepatitis C, they've all been documented to be transmitted from healthcare worker to patient, from patient to healthcare worker, and from patient to patient. And because we have been using standard precautions in many locations in the world for a good number of years now, we have evidence that it works. And so there's no reason to fear providing dental care or receiving dental care, but there is reason to follow standard precautions and ensure that we're doing everything we can to make dental treatment safe every day. Some other things that we can do while we take this pause is do some online education such as this, and look for other means of education, and then have conversations with the rest of the people that you interact with at work, and talk about infection control, what we're going to do different when we come back, and how we can make things better for everyone. And then when we do come back, when things do return to normal, make infection prevention and infection control a part of your daily or weekly discussions within the dental team, so that people can bring things up, ideas for how they can make things safer and better for everyone. I think that just relying on the dentist as the team leader to do everything is not the best method. You need to involve everybody who has a hand in providing care to patients, so that they can communicate to patients, because patients are going to be scared too. When we come back, they're going to wonder if it's safe to go back to the dentist. And we have to be able to reassure them that it is, that they can come back, and that we can treat them in a way that's going to be safe for them and safe for us. And there's still a lot of questions that we can't answer. We don't know exactly what that's going to look like when we stop taking this pause and we do try to come back. It could be gradual, most likely it will be. And there are parts of the world where they're starting to come back. There's places, especially in Asia, Hong Kong is getting back to normal, but they're doing it slowly. And that's probably how we're all going to need to do it. And I hope today's seminar provides you with some information, food for thought, and things that'll help you feel safe and be able to get back and practice safe dentistry. Thank you. Next speaker.
Hello.
Yes. Yes. Thank you so much, Dr. Cuny, for giving your insight. Next up, we have Ms. Bryony Lowe, who is implant nurse treatment coordinator and infection control course tutor at King's College Dental Education Center. Please join us, Ms. Bryony, on camera and video. And hello.
Hello. Can you see and hear me?
Yes, we can.
Yeah, okay. So thank you for having me. And I agree with Professor Cuny. This is teaching us a lot. Since the World Health Organization declared COVID-19 outbreak a pandemic, the UK's guidance is being reviewed daily. So the information I talk about today may not necessarily be true tomorrow. It's really important that it's your own responsibility to get as much knowledge as you can about COVID-19, as things are very fluid on a day-to-day basis. And as it was mentioned before, you can get a lot of this online. The topic we are touching on today is how are we going to adjust our dental practices once we are back up and running. PPE is a massive concern to us, and we need to get this right. We know that standard precautions make us very well equipped and very good at dealing with bloodborne pathogens, but the coronavirus seems to target specific cells within the nose and throat, and this appears to be a primary viral reservoir, which is why, as dental professionals, we need to be aware of this. It's been shown that respiratory secretion droplets are produced from the nose and mouth, which to me is a massive red flag in dentistry. So I want to suggest how you can move forward in primary dental care. So how will PPE move forward within primary dental care post-COVID? The current recommendation would suggest that we need to standardise our basic PPE to include full surgical gowns, FFP3 respirators and full visors. We will need to provide training for these masks to be fit checked, as they are ineffective unless this is done properly. Do we need to change? And if we do need to change, what changes do we make? As Professor Cuny said before, we don't know exactly how we're going to change things, but we currently treat everyone as though they have a blood-borne virus. So post-COVID, we need to include this school of thought to diseases that travel in aerosols. Medical history should need to include different questions, perhaps, so that we can help determine whether a patient may have any transmittable respiratory infection, as we've seen with COVID-19, SARS and MERS. I would ask different questions, such as, are you experiencing lack of taste and smell, as we know that this is an early sign of COVID-19? Do you have any shortness of breath or a dry cough? And something else you can easily incorporate is temperature taking. We will need to adjust patient timings, such as allowing more time in between seeing patients for air changes and cleaning of surfaces, which currently are being practiced in emergency dental centres with 1 hour per patient. Installing air filtering systems will make the running of day-to-day procedures more efficient. One thing you could consider is installing a negative air pressure room for all aerosol generated procedures. Is this where we're going? Always working with a buddy to ensure we are donning and doffing correctly, as we know that this isn't always done right. The hospitals here are doing just this, along with having designated rooms to do it in. Wearing FFP3s as standard. Are normal surgical masks sufficient? Perhaps not. We know that they aren't for aerosol generated procedures, but what about when we are doing an exam and we get our 3-in-1 tip and blast a whole load of plaque and debris off the margin of the tooth so we can see it properly? This will generate some aerosols. If we choose not to do this, it means we're compromising treatment for a simple examination. Frequently disinfect objects and surfaces such as door handles and front desk areas. Some practices have gone cashless to avoid touching money, and not forgetting to wipe down card machines as part of the reception cleaning process. I also suggest getting rid of magazines that patients regularly handle. So would the changes ensure that patients and staff could continue dentistry in a similar situation, given that all dentistry has now stopped? Let's face it, none of us want to stop seeing patients. We are all in this because we feel we have a duty of care to help our patients and free them from any discomfort and pain. Are we able to do this? No, we're not. We are in fact passing in our patients to emergency dental centres who are doing our job for us. We are still not providing routine dental care, and many dental practices are triaging patients using the 3 A's, which is advice, analgesic and antibiotic. We need to consider the ripple effect this has caused for dental surgeries and how we need to change. For example, the Resuscitation Council here has now advised that we shouldn't look, listen and feel before determining if someone is breathing normally, and to default straight to chest compressions. This is because if someone coughs in your face, you will be putting yourself at risk. Our medical equipment will be something we will need to reassess as part of standard precautions. We will need to include FFP3s within our medical emergency equipment list. This is in the case of hospitals right now. If you're not wearing full PPE, and this includes FFP3 masks, you are simply not allowed to perform any kind of resuscitation. And why should that be any different for us? We need to get to a stage that when we're all back to work, we know we are all working in a safe environment for both staff and patients. I hope I've given you all food for thought and we are all able to embrace the changes that will come once we are back to work. And thank you.
All right, now we have Dr. Kashif Hafeez joining us all the way from UK. He was honored by membership and fellowship from Royal College of Surgeons. Ireland, and has been honored with fellowship from Royal College of Surgeons, Edinburgh, for his services. Dr. Kashif, on to you now.
Thank you very much. Thank you very much. Can you all hear me? Can you all hear me? See me?
Yes, sir. Everyone can hear you.
Yeah.
Okay. So, hello everyone, and I will share with you some fruitful thoughts and the question that has been coming in my mind as well, and try to answer those questions how I think they are going to be dealt with. At the moment in England, we are only seeing emergency patients, and emergency patients are the patients, they are in dire need of dental treatment. Like a lost crown or a lost filling or a sharp tooth is not an emergency, and we're not entertaining these patients. There are very interesting Scottish guidelines which will actually classify the patients into different categories. And our local area teams have divided these patients into different categories. So like patient who needs urgent dental care, which needs to be seen there and then. Then there are the category of the patients who are going to be seen in the first 24 hours. Then there is category of the patients who are going to be seen within the next 2 or 3 days. So you need to ask these questions from yourself, that which are the patients which are going to be seen in the first 24 hours. Obviously, the patients with facial swelling extending towards the eye or the neck, those patients are not going to be left alone, and they are going to be treated straight away. The second kind of category is where they're going to be treated in 24 hours. For example, as Bryony has already mentioned, that we are following the protocol, which is advise analgesia or antibiotics and assessment on the phone, and that's it. So, for example, if you've already tried analgesia, you've already tried everything, and the pain of pericoronitis is still not going away. So, how are you going to treat with those? How are you going to deal with those patients? So those patients are going to be treated in the first 24 hours, or they're going to be assessed, or they're going to be seen. So we need to establish that kind of protocol in the countries where this protocol is not being established. Now, I'm getting feedback from my friends that in Asian countries, or in the countries where the system is not that established, literally all the practices are closed. That is not right, because your patients needs to go somewhere, and that is our ethical duty now, to deliver it to our patients in this hour of need. Because if they have got emergency, where they're going to go if everything is going to be closed? So that's the question I need to ask you. But at the same time, you don't have to put yourself and your staff into risk. So you need to go through the guidelines which international world is following to see those emergency patients, to see how you can categorize, filter these patients, and how you're going to see them fulfilling the current requirement for the PPE. Now, the current requirement of PPE is changing rapidly as well. For example, FFP3 respirator, the new English guidelines are saying that they can be used for a session, not single use. So a session can be morning session or afternoon session. When you stop working, that's where the session is going to stop. So if you've got FFP3 respirator, then you should start thinking on those terms. And those FFP3 respirators, they have to be fit tested. If they're not sealed tight, then they're not working properly. You might as well not use it. Then now we were all thinking about the kind of diseases which can be transmitted from the patients to us. Now, this COVID-19 has brought us into an era where patients are going to be afraid from us as well. That, okay, I don't have COVID-19 when I walk into this practice. Hopefully I'm not going to get COVID-19 when I walk out of it. And how are you going to reassure those patients? So I think follow strict guidelines which are being followed, and you have to invest on those PPE. If those PPE are going to be bought, but who's going to pay for it? So then you have to look into your financial model as well. And the timing of the patients, the frequency of the patient is not going to be the same anymore. So you need to relook into your financial model. What I would I would suggest is to risk assess your practice. Each and every practice should do a risk assessment and follow that risk assessment. That how risky it is for you to go into that practice, how risky it is for your staff to go into your practice, or how risky it is for your patients to go into your practice. For example, it's a very small thing. How do you take money from these patients? If you're going to take cash, that is a risky thing to do. How are you going to protect your reception staff from taking cash? So you need to devise some protocols. You need to come up with some ideas. You need to come up with some guidelines. For example, advance backs payment. They need to transfer the money advance in your account, and everything has to be backs payment. How are you gonna actually filter those patients medically? So they're gonna call you, and you're gonna filter them by having a medical questionnaire, which your receptionist should ask each and every patient. But between the time they call you and come into your practice, 1 week is gone, and in that 1 week, they may have been exposed to COVID-19. So that medical history questionnaire has to be repeated again and again. That has to be updated again and again. So those guidelines, these protocols have to be brought post COVID-19. Cross-infections protocols has to be looked into. We know that some of the practices, they may not be following the strict cross-infection protocols. They need to be looked into. And it's not only you which are your risk, your staff members, their families, your families, because you're going to go back and you're going to carry the virus with yourself. So how are you going to make sure that that virus is not carried back home to your family? So in short, there are a lot of uncertainties, but you need to act sensibly. And I think the key home message from this small talk is you need to do your own risk assessment. Thank you very much. Thank you.
Thank you, Dr. Kashif. Now we have Dr. Aqib Mudassar, who is the founder of Next Level Dentistry, located at Lahore. Please join us, Dr. Aqib, on camera and video, and hello.
Hi there. So throughout the history of mankind, we have faced challenges like this. This is nothing new to us. And I have always come stronger and better out of these things. Some of us will figure out solutions and answers. And soon we will go back to work and we'll go back to malls and restaurants. And our dental offices will get busy. It's just a matter of time. And I always have said that, things happen in life, how we react to it, how we take care of things, and how we go about it, really what determines the outcome. Some of us will step up the game. They will invest in the things which they need to, or they will figure out the opportunities and challenges, and they will invest in the team, because without really getting our team on board, getting those international standards for cross-infection control, really we're not able to get past this thing. Unfortunately, they will be ones who always look for shortcuts. They look for cheaper options, and I think they will be the one who will pay price heavily, and maybe most of them will not be able to survive. And that might be a good thing for dentistry in a way that those are the ones who are hurting dentistry in the first place. It will be a lot easier for people in Western world to go back to get dental treatment done, because there are strong systems there. They have standard of care. There is universal protocol for cross-infection control strictly implemented. And then if something goes wrong, there are rights protected. Their rights are protected. Unfortunately, we lack these things here in our country here. And unless we change that, because a lot of people are already afraid to go to dental office, thinking that they might get like hepatitis and whatnot, and with COVID, and especially now, people are getting a lot more awareness and information on protocols. And then we have another group where they pay hefty amounts of their discounts and crown and and whatnot, and end up losing teeth just like me. And I think that would really make it challenging for those people to just go on about it after COVID, because people will still have pain, they will have the problem, and they need that help. And we're going to have to fix our issues. We have to raise our bar. We have to establish standard of care. We need to provide safe and predictable dentistry. And If we can do that and then go back and assure our public that it is okay to get dental treatment, thing done, and I think that will be what we need to invest in right now, because we'll have a lot of time which we never did before, and this is the time we need to invest in these things, because we think we also might have few months before we can go back to the full routine, and this is the time to invest in these things. There's another opportunity I see is with practice management, especially with COVID. And once we go back to offices, we need to space out our appointments. We need to make sure that there are not a lot of people sitting in the waiting room. Actually, there are not patients sitting in the waiting room. And I think practice management can bring that, because not only it helps us schedule productively, but it also increases profit margins. And other thing which I want to emphasize is is the oral system connection. We know that COVID hits harder those people who are compromised. They have a compromised immune system. Infection in the mouth can cause problems like heart attack, stroke, diabetes, pancreatic cancer, arthritis, and so many other things. And because of that, our immune system gets compromised. Also, infection in the mouth brings in a tipping point in inflammatory burden, leading to compromised immune system. So with this COVID situation right now, we need to acknowledge that, we need to work on that, we need to bring in complete health dentistry, and we need to create awareness in public about it. And not only will help save a lot of lives, will reduce the cost of healthcare, will improve quality of life for so many people, but it can open opportunities for dental community as well. Like I said, we have time now, which we never did before, and how we utilize this time in next few months really is going to determine the outcome. It's gonna ensure our future post-COVID. And those who will step up the game, they will invest in things which they need to. And we do know that we are far behind when it comes to the standard of care. We're far behind at level where international dentistry is, and that is an opportunity which really is that space, that vacuum is an opportunity for us to do the right things now, so we can capitalize on the true potential dentistry has to offer. I know that 9% of my revenue comes from pain management in my practice in Lahore. It was the same in California, and most of dental practices in Pakistan, they generate their revenue from pain management. That 90% of out there, which comes from elective and preventive dentistry, it's all there for us to grab. So once things settle down, once we are back to full swing, if we invest in the right things now, if we do the right things now, we can capitalize on that. So we'll emerge stronger and better once everything is settled. Thank you.
All right, thank you so much, Dr. Aqib, for his insight. Now we have Dr. NAzeri with us. He is the founder and executive chairman of NAzeri and Company Co. Limited, and a firm focused on healthcare advisory, consulting, investment banking. He's also the CEO of Dr. NAzeri Healthcare Advisory Group based in Bangkok, Hong Kong, and Las Vegas. Please join us, Dr. Alen, on camera and video, and hello.
Okay, sorry. Good evening, everyone. I had to unmute myself. First, I'd like to thank the organizers of this event to bring this, everyone together so we can all pitch in regarding, what our ideas are. So hopefully the people who are joining us can take some value lessons away. Because I have a very short, limited time, I'm going to get right to the point. First, I'd like to remind everyone during these times is when creativity is born, and those of you who are proactive and outside of box thinkers will not only survive this time, but you actually will become much stronger on the other side. I personally think that we will be with this COVID-19 for a very long time. I know the media keeps talking about, flattening the curve, but as you can understand, once they flatten the curve, they're actually elongating the curve. So flattening the curve helps the, not to overwhelm the hospitals and emergency rooms. But as dentists, I think you guys will be affected by it, for quite some time, for a long time. So it's important that you plan accordingly and to and I will share with you what are some of my thoughts or my predictions as they will happen in dentistry. Now, even if we go back to business as normal, I think you will find that most people will not have their discretionary income because they are tapping into their savings right now. Because across the world, I'm based in Thailand right now, but across the world, every business is shut down. So definitely elective dental treatments are going to take a back burner, and it's not going to happen, you know, for many dentist practices. Now, fields such as orthodontics, where teledentistry has been, you know, becoming integrated part of that. Okay, it's absolutely. Can you mute yourself, guys? I lose my concentration. If somebody's not mute, can you please mute? Thank you. So so it's very important that let's say your practice maybe is located in a country where dental tourism is popular. Okay, maybe you will get some of the patients coming from other countries where they cannot afford dentistry in their own country, but it's still, I think we'll have problems with conduits of journeys or travel and restrictions, because this COVID-19 is pretty much not the same peaks everywhere in the world, and there are many countries that are still at the very low stage of it, or they have not done any testing and so forth. But just like internet changed the way we do things, from shopping to going to the library and getting rid of video stores by streamlining videos for us, and Starbucks getting rid of a lot of the coffee shops and all that. I think this raised social awareness that we're experiencing because of COVID-19 will not, it already has changed the way we do things, but it's really an opportunity for yourself to reinvent yourself and start thinking outside of the box what is possible. Now, most groups that I work with, and I work across the globe, from Europe to Asia to US, most groups, the amount of cash they have on hand is typically about half of their month's revenue. So, and some of them, they have access to lines of credit. Some of them, they do not have access to lines of credit. But in situations like this, what would happen, because I went through the financial crisis in 2008, and I know that even you have a line of credit, because other people are defaulting on their payments, what would happen is a lot of times they're reducing those lines of credits for the practices. So one of the things is, if you have access to line of credit, I recommend that you actually pull the money out of your line of credit, put it into a savings account, and keep it there, because cash is the king right now for your situation and so forth. Now, as a practice owner, you have some opportunities. So what you need to do, and dentists are obviously notorious about being independent and like to compete with each other, but this time is not about competition. It's about cooperation, how you guys can all cooperate together, so you can really reinvent the way you're doing things and your practice as well. So if you're in a community, identify 5 or 10 dentists in your community and see how you guys can bring your sources together and leverage that. If all of you, let's say you have 10 dental practices, maybe you can all combine your practices and have 3 large group practices. You need to look at the number of staff you have, the equipment, the inventory, the available cash, your physical facility. And right now, there are many commercial properties that are going to become available that I think you can all get very, very good deals on it, because of the fact that many businesses are going to go out of business. Now, one of the let me go quickly through one of the predictions I have for this. After COVID-19, what you're going to see is group practice is going to really explode, because many dentists are not going to be able to afford to economically withstand to be on their own. Okay, so having group practices are very is a big part of it, but not just any group practice. I think patients will be very picky what type of a group practice they go to. They will definitely stay away from group practices that are based on volume. They want to avoid going to crowded waiting rooms and so forth. So you're going to see group practices that are spacious. Probably they're going to offer treatment in more like a operatory facility where they can actually circulate the air and have all sort of, you know, protection and safety and so forth for the patients. So this is very important. The other offices that they will do well are offices that are going to invest in their automation infrastructure. And automation infrastructure, I'm talking about anywhere from the first patient contact to consultation, post-ops, anything that they can do. So as a matter of fact, many offices are probably going to just do the intakes on the video call such as this, because the offices that are going to lessen the touch points with the patients, I think, are going to be definitely the winner. So you need to think about how you can invest in this infrastructure and try to create, you know, something based on that. Other practices that are going to come out well are offices that are able to offer mobile type dentistry, okay? Mobile dentistry, do not underestimate this, because people who have money, they will have a dentist or a hygienist come to their home or their place of living, okay? Maybe it's a high-rise building, they will put a special office there for doctors or checkups, just like personal chefs are becoming very popular. And, you know, your hairstylist can go to the home, or your nail care person. So if you can think outside of the box, how you can bring mobile dentistry to this mix, I think many patients would like that, to be away from, you know, crowded places such as this that we're talking about. And also offices that have obviously long hours, convenient hours. They accept different types of insurance. You cannot be picky. You got to take different types of insurance, have different types of payment plans, okay, available. And also if you can offer some sort of like, you know, memberships and so forth, I think those would definitely be popular. But the most important thing, I think, right now is about differentiating your practice. If you do not differentiate your practice, you're going to have some problems. And differentiation is about external marketing, about communicating with your patients that what it is that you're doing, but also differentiating it from internal factors, internal marketing. This is where, you know, I've been, you know, teaching my, you know, clients and so forth about how they can improve their case acceptance. Because if your volume is going to go down, you're going to have to increase your production per hour. So convincing and communicating with the patient that they should do, you know, 5 of their, you know, crowns instead of just a single tooth dentistry, it's a special skill, as well as your clinical skills, because you can be the best dentist for a single crown, but, you know, doing a full mouth case or a comprehensive case is totally something different. You have to learn how to manage it well. It's kind of like someone who is, you know, who's able to build a room like a contractor, but building a high-rise is different. So you really have to invest into those things. And this is all I have to tell you guys tonight. I know our time is very limited, so I appreciate everyone. Thank you.
Thank you so much, Dr. Alen, for your time and for your feedback. Now we have, lastly, Dr. Kashif Ikram. He's principal of Wakai Dental College and specialist in oral medicine and implantology. Please join us, Dr. Kashif, on camera and video, and hello.
Hello. Dental news, medical news, and the organization who organized this. Such a lovely. I'm quite enjoying as a actual listener. But anyways, I was listening all these speakers talk. I figured out we actually need to change the mindset of the healthcare professionals, especially dentists. People have learned through internet, through Google, which practice to select and how to select. And I agree with Alen and other people. Things are going towards group practices. I was going to the topic which says Future of Dentistry, Opportunity and Challenges. I came across SWOT analysis. Albert Humphrey who led a research project in the 1960s, and he explained this term SWOT. That stands for SWOT. S stands for strength, W for weakness, and O opportunity, and T for threats. My suggestion to all dentists, especially working in high-street practices, it's a high time, again, second and third, Dr. Alen's, to start working as a specialist practice and group practice, because it's difficult to survive individually. A true SWOT analysis cannot be done effectively by just one person. So what are the strengths are? The strengths are the skills, the knowledge we learn. The team experienced good education. We got to educate ourselves and the team, all those cross-infection protocols and regulations, because practices who educate the patient will only survive. That's their strength. Look at the weakness. They lack of education, they experience the knowledge, restricted and imperfect expertise. Lack of motivation among the team members, because if you don't provide them good personal protective gears and educations and experiences, they will not work for you. This is a part of practice management. People do not take appointment of the practices where they don't see energy, because we have a concept, we plan it, and we execute this. It can only be done if we would like to improve our businesses. The opportunity is to thrive in open market with leading clinicians. Only the learned, trained clinician will survive. Because as other speakers suggested, until and unless we learn the right protocols and the right way to work in a clean and sterilized environment, we cannot provide treatment to our patient. People, especially I as a patient, will not go to a practice where I will not feel comfortable and safe. And I agree with Dr. Kashif Hafeez. Hep B, Hep C already been our enemy. Now, I wouldn't like to get COVID-19 or any viral infection from ex-practice. So I like to be safe. The threats is lack of business and financial downturn. In our part of the world, especially in Pakistan, the regulatory bodies, Health Commission, HCC, PMDCs, they are not as effective. I suggest that all the professionals should follow the international regulations endorsed by PMDC and Health Commission and HCC, because it's a duty to create the environment with scientific and professional approach. I suggest all the dentists who are practicing in high street practice that in order to provide a good practice, they need to educate and create awareness among their team first, and certainly invest in their practices. I was listening a couple of questions before the programs that yes, you need to go back and see what you are providing in your waiting rooms, in your practices. I also work institutions, so there's a problem. What are we giving training to our students? The problem is all the institutions are closed now, and you cannot train your students the right kind of training, because you can't train for all psychomotor skills online. You only train knowledge and attitude. The problem is this kind of pandemic needs well-trained clinicians. My concern is, are we creating more fears? Are we training our students enough to go in the street, on the high street practices, or in the community, or on this problem like this? They're all scared. We need to train them with well-versed scientific data and educations. So I see lots of problem in institutions, because I spend half my life in institutions. I see lots of lack of interest of people who are going to spend the energy and the money now in this business. So we really need to change the mindset and the approach with the scientific and professional approach. So with these words, I'm really thankful again to Dental News and Medical medical news, because this is really a problem at the moment. As I agree with Dr. Kashif, things are changing every day. So keep up the faith, keep up the hope alive. The sky is the limit for people who are ready to work and fight hard. Thank you again.
All right. Thank you, Dr. Kashif Ikram, for your insight. Now I've actually added some questions from our audience. We have asked them to drop their queries during the session and before that, and I have picked 3 of them. So let's see. The first question that I have is, in third world country like Pakistan, where the protective equipment are already not available widely, should the helping staff at the clinic can be asked to get their own equipment? What does the rule book says? I have also copy pasted the this question on the chat option so guys can see it in words as well. So I think this question can be actually answered well by Miss Bryony, because she is someone who actually deals with cross-infection protocol topic. So I'm unmuting Miss Bryony. Miss Bryony, are you with us?
Yes, hello, I'm here. Yeah, so I think that the people that you employ are also the people that you have a duty to care to protect. So it's kind of your responsibility to ensure their safety. And if you're not able to provide them the appropriate PPE, then they shouldn't be working. In the UK guidelines, it's definitely the employer's responsibility to provide that kind of thing. So, does that answer the question?
Yes, I had that. I also wanted to get feedback from our Pakistani dentist as well. Dr. Kashif Ikram, do you want to add into this?
I agree with Bryony. There is no exception or alternative. If you cannot provide the right gears to your patient, you shouldn't be working. And that's what I said in my point. You have to work with scientific and professional behavior and attitude. You simply cannot say it's not available. Then you should not be practicing.
Yeah. Let's move on to the next question then. Okay. As a dentist, I have water cooler, snack bar, and newspaper facility as well in my clinic. Should I close all such facilities for the sake of safety from coronavirus? This is something that I've actually received this question. Let me put it out for my panelists as well in writing as well. So I think I should better give this question to Dr. Aqib. Dr. Aqib, are you here with us?
I think we're gonna have to do what needs to be done to get by this time right now, and less is more right now. And just like we're supposed to remove all the papers and whatnot. I mean, just have to be safe for right now. But eventually, when things go back, I mean, we just go back to thing. But we're gonna have to find solutions and answers. A lot of things we don't know right now before we can do.
All right. I have my last question. I think we should ask this from Dr. Kashif Hafeez. I'm providing dentistry facilities. Oh, where was this question? Yes, I'm providing dentistry at doorsteps to my locality. Should I continue that facility or not, as that can be huge potential risk for my patients and for myself as well, especially when we have lockdown in an area? Is there an alternative? Yes, Dr. Kashif Hafeez.
Lockdown does not apply to key workers. So key workers are always exempt to avoid not going out. So I mean, the key workers are there for the society to serve the society. So as a key worker, you should be able to get out and go to your practice. As I mentioned in my brief talk, you have the duty of care to provide emergency dental care to your patients. You cannot just close your practice and say to your patients, go away where you want to. This is the time where your patients needs you. And at the same time, you shouldn't be putting yourself into risk. So as an employer, it's your duty to protect your staff, to protect your patients, and protect you. So we shouldn't be acting as opportunistic dentists where when the profits were high, we have open clinics. And when now the profits have gone down and we have to invest on PPE, and we are closing down the clinics. That shouldn't work like that. as an ethical member of our society and our service to society, we should be providing emergency care to our patients.
All right. Next up, I have this question all the way from India. She's asking, is there any different COVID-19 consent, or if it is, then what it is? I should ask this question to Ms. Eve. Ms. Eve, are you here with us?
Hello, thank you. I'm not aware of any particular consent for COVID-19. I'm not exactly sure what the question is asking. I think perhaps having some consent form from the patient acknowledging that being treated during this pandemic might pose a risk of transmission. I have not seen, at least from my perspective in the US, and of course, in the United States is a very litigious society, so we're very aware of consents being needed for many things. We personally are treating emergency patients using appropriate PPE, and we are not asking the patients to sign a consent. However, we are having a discussion with them on the phone before they come in. If they must be seen for treatment, if they have a severe infection that cannot be treated pharmacologically, we will treat them, but they will have a conversation with the dentist on call first about how to about the risks and about how to prevent those, how to minimize those risks to the greatest extent possible. And I think that's the communication is the most important thing that you can do with your patient above and beyond any consent that may be legally required. Putting them at ease is going to be very important.
All right. Now I think we shall move on to our discussion round. That'll be allotted for another 15 minutes. I will divide my panelists into two groups. The first group we have is Ms. Bryony, Dr. Kashif, Hafeez, and they'll talk about cross-infection protocol. So I'll open the, unmute both of you so that you guys can discuss about the cross-infection protocol. Dr. Kashif, Hafeez, are you here with us?
Yeah, I am. I think there is a question and answer chat going on as well. So I think I can see two questions in there. One question is about the patient charges. One question is that should I increase the patient charges as I'm spending more money on PPE? You have to make your own financial model. Of course, if you're using the the effective PPE, somebody has to pay for it, and that is going to be either you or you. Yes, you need to look into your charges because now it's the problem with aerosol as well. So I think, yeah, you need to look into your patient charge. The second question, which was there in the live chat, was from Dr. Aram Chauhan, saying that what do you suggest about the aerosol we produce in our practices? I think the whole protocol needs to be changed because of this aerosol. You need to have surgeries redesigned where there will be effective cross-infection, where there should be effective ventilation measures taken, so that some hood which is going to extract all the aerosol and take it away, some side of tubing that's going to extract the aerosol. So all these protocols have to be changed and they have to be looked into. That's why all over in the world, the dentistry has stopped, because this has posed a new threat to us. Previously, we were used to put things in a sterilizer and we were happy. Oh yeah, we've killed all the spores, prions and everything, and we are happy. But now we have to tackle this. So everything from start to finish has to change. Even your, as Bryony said, door handles. So everything has to be looked into.
Tony, you want to add something into this?
Can you hear me? Yes. No, I agree with everything that you say. I think that things are going to change. I think that we are probably going to end up seeing less patients per day to accommodate these changes. I think that we will need to give our dental nurses more time in between each patient to have airflow changes, and to do the wiping down of all surfaces. Reading manufacturers' instructions of these products that we're using is very important as well, because I know that if a surface needs to be left wet for 2 minutes, Are we actually doing that before the dental nurse is rushing around in between each patient? So these are all things that we need to consider. And I definitely think that seeing less patients a day might be something that we need to factor in for all of this. I think appointment lengths are going to take longer for simple things, just as examination appointments.
All right. Do you have further thing to say, Dr. Eve?
Pardon?
Yes, I think I keep thinking back to the time of the AIDS crisis, because I was working in infection control at that time too. And I think I see a lot of the same uncertainty that's born out of the fact that this is a new, excuse me, a new infection where we don't have all the information that we need yet to know what the future may look like for dentistry. And I think we can right now, we have to be vigilant, and we have to do the things that we need to do to prevent the spread of this disease, because we know that it's spread very easily in community settings, including in dental offices where we generate aerosols. The next year will give us a lot more information as the science is emerging about the transmissibility of this disease. It's still not completely certain whether we know that it's mainly droplet, but we also know that it can be found in the aerosols that are generated from our devices, because the virus can live in saliva since it's connected to the respiratory tract. So I think we have to be cautious. I know one of the other questions in the chat box was regarding, new technologies, and I know that we've seen many people coming up with ideas about things that may, excuse me, reduce the risk in a dental setting, but these need to be validated. They need to be tested, and they need to be shown to be effective before we start using something that may not work and feel that it's providing us protection that it doesn't. So I think the message here is proceed with caution, proceed with care, and follow the science and look for the evidence. And we probably are going to have to change a number of things, but we just don't know exactly what all of those are yet.
Thank you, Dr. Eve. I think now I'll move on to the next part of the discussion. We have Dr. Aqib, Dr. Alen, and Dr. Kashif, and I want you guys to give your insights and your own feedback about the whole financial issue that has actually raised because of the COVID-19 situation. So what are your feedbacks into it? Well, how are you guys looking into the situation right now?
Can I say something?
Sure.
You see, when a patient entered into the practice, the time he entered the practice, start making an impression, am I coming back here or not? So it's the responsibility of the principal of the practice that he should engage the patient attention from entry to appointment to exit. That means he has to invest in his environment, on his system, on his procedure, and the team. Because if I, as a patient, go to a clinic, if I'm convinced that this practice look after me and care for me, I will go back in again. So it is not about making a decision of where spending or not spending. I have to spend energy and time and lots of resources to attract the patient to my practice. That's point one. Point two is not only attract, also have to invest how to make the patient visit very safe. We are only fearful if we don't have any information and knowledge. As a human being, we are petrified and we're fearful if our eyes are closed. So it's a high time now, as I mentioned, the opportunity and weakness in the SWOT analysis. It's a high time to learn and acquire knowledge and eradicate all the fears. Because it's not a new time. For the first time, we're living in this world with this problem. So it's our responsibility to perform in the situation and do not shut your eyes and close the practices. Learn and get up for everything.
Dr. Alen, you want to add something to this?
Yeah, I mean, just like Doctor just mentioned, I think one of the things that it has always been helpful working with various clients is to have you map out your workflow process. So I would map out like every procedure that you have, exactly what happens when the patient comes in and what you go through. Once you map this out, you see where some of the gaps, if you may, are in your safety standards, for example, as well as identify some bottlenecks in your practice. And then you can see where you can introduce various technological advances to reduce that patient contact point. So those are something that I definitely suggest. And I see Miss Nari from Cambodia. She is asking me about the mobile dentistry. So I'm going to just answer that really quickly here. You know, Nari, the mobile dentistry is something that has been around for a long time, something that practices can do. I mean, this is very normal in the US. I mean, we do have networks of mobile dentists that they actually either have a GP dentist, and I know you run several, you know, large group dental practices in Cambodia. So, you know, you could actually have a dentist or a hygienist go to a facility, you know, and, you know, with all of these dental monitoring tools that are available, they can actually report back to the dentist if let's say it's a hygienist going there. And so mobile dentistry is something that you certainly can be a competitive advantage for groups. Okay, and I see that as something, you know, beneficial. But we can chat about that later after the call. So, okay, thank you.
Yes, Dr. Aqib, we want to add into something because obviously after this whole chaos, we really want to come back to our normal life. So is there anything you can add into this?
It's going to take some time for us to get back to work and to full swing. We're just going to be dealing with some emergencies and procedures which are recommended by ADA right now. And this is the time to really do our self-analysis, figure out where we stand and what we lack, what are the opportunities, because I mean, we are really behind with systems and with structure and with proper techniques. And this is the time for us to really take time and invest. And I think most of the problems will be solved with implementation of practice management. There are two components which I see with this. So one, we'll have to figure out the aerosol and all the technical things involved with it. And I'm sure the companies, big companies, they are working on it, and soon we'll have answers to those. But then the business part will be driven just by practice management. Be smart, really have a coordinated team effort. We start our day.
I think I have lost Dr. Aqib there. Dr. Kashif,
Can I-
do you want to add
Yes,
something to this?
yes. I think the time is not far. Like we check people blood glucose in the practice. We'll be having the kits in the practice to check the positivity of the COVID-19. And that's all the problem. If you know the patient is positive, you won't treat against the guidelines. So I think the time is not very far. And I would suggest if you really find a vulnerable patient who needs good treatment, loss of aerosols, check the positivity first before you work in the blind environment. Thanks.
All right. I think with that, I shall wrap up my discussion and expect that everyone has learned something from this session today. Special thanks to all our panelists, Ms. Cuny, Ms. Bryony, Dr. Kashif Ikram, Dr. Kashif Hafeez, Dr. Alen NAzeri, Dr. Aqib, for taking time out from your busy schedule and sharing such important, kind of feedback for this course. Now I'll ask Dr. Aqib, is he here with us? Or have we lost Dr. Aqib? I think we have lost him. I shall thank you and wish you all the best. All right. Allah Hafiz.
Thank you. Bye-bye.
Allah Hafiz.